So my name is Gaudensia Mutua. I'm a medical director at IAVI. Prior to joining IAVI, I worked for 16 years at a community-based research center. I was mainly working in HIV vaccine research. Currently, I oversee studies that hopefully will lead to the development of a Lassa vaccine. Lassa virus is part of a group of viruses we call the arenaviruses, and it causes a hemorrhagic fever, which is a disease that's endemic in certain countries in West Africa. This disease is actually a zoonotic disease, which means the infection jumps from animals to humans. And in this particular case, it's a certain type of rat that causes the infection through contamination of food or household items. There are many cases that are probably unreported, but we do know that up to 20% of people who are infected will develop fever, hemorrhage, and sometimes even hearing loss. Pregnant women are uniquely susceptible to this disease, and it causes spontaneous abortions or even maternal death. And we do know that up to 15% of people who are infected actually die if they're admitted to hospital. This is a seasonal disease, and we think traditional estimates have put the numbers at between 100 to 300,000 infections per year. But some of the more recent data suggests that the numbers could be upwards of 5 million infections per year. So currently there's actually no vaccine to mitigate these seasonal outbreaks. The disease does have a human impact in terms of the people that die or people who become disabled from the infection. But in addition, there is also an economic impact. It is actually estimated that if we had a vaccine today, we could save up to 120 or 130 million US dollars in the next 10 years. For almost 30 years, IAVI has been involved in vaccine research. We have conducted research in HIV vaccines, TB vaccines, and other emerging infectious diseases. Therefore, we feel IAVI is very well positioned to work with partners and other experts in the space to lead this program of developing a Lassa vaccine. This is an unmet need because it really affects mainly people who are living in middle and low income countries. So the first study we conducted with this vaccine was done in 3 sites in the US and 1 site in Liberia, and that study was completed in December 2023. The results of that study have actually been recently published in the New England Journal of Medicine, and we were able to demonstrate that the vaccine had an acceptable safety profile. In addition, a single dose of this vaccine was able to elicit not just a robust immune response, but also a long-lasting immune response. So we currently have a phase 2 study that is ongoing in Nigeria, Liberia, and Ghana. The study we are conducting is being done in partnership with communities that are participating to ensure that we are conducting the study in a manner that is ethical and in a manner that is safe and also respectful of the communities that work with us. In the long term, if this vaccine is found to be safe and efficacious, IAVI's commitment is to work with partners to ensure that the vaccine is available, is affordable, and is accessible to all the communities that need it.